I'm 35 years old, and my doctors were telling me that I would be lucky if I could reach 50 without double knee replacement. When I was in 6th grade, so when I was about 11 or 12 years old, I caught rheumatic fever. For those of you who don't know, it's a disease of the heart and joints. My knees were the most affected area. They literally swelled up the size of bowling balls, and they were red and hot to the touch. I was in dance since I was 3 years old. Finally stopped when I was 17, having terrible knee pains and my knees just always hurt. I've already had 2 surgeries on both of my knees. I've had the orthoscopic surgery where they had to go and clean out the cartilage, and my doctor told me that there was actually a lot of scar tissue, which ends up it was from the rheumatic fever. And on my second round of surgery, I had both of my knees cleaned and orthoscoped at the same time. My doctor told me that I had terrible rheumatoid arthritis in there, and that he was able to shave away a lot of it. And on my left leg, I had still some really terrible pain, and I had a cyst and a cyst type tumor removed from the back of my knee. So I have a 4-inch scar from the back of my leg, and thanks to the TZone, I can actually walk, and I can bend my knees up and down. I can go run and play with my kids. I can mess around with all my kids all the time. And it's because of the TZone and what it's actually brought to me. My doctor were telling me that I'm 35 years old, and my doctors were telling me that I would be lucky if I could reach 50 without double knee replacement. I think I'm pretty much going to take that and say, thank you, no. I'm going to keep on my TZone. I'm going to play with that every day, and I'm going to make it so I can actually walk and still hang out with my kids and keep up with my teenagers.